Solubility and bioavailability enhancement techniques. This is the topic for the present video, and in this video we are going to see and learn about the technologies related to API, related to the formulation for improvement of the solubility of insoluble APIs and thereby improving the bioavailability. Welcome dear viewers to the video, and I hope after watching this video you will be able to understand the different technologies for solubility enhancement and thereby enhancement of the bioavailability. See, the BCS classes divides the drug substances into four categories, or four BCS classes are there. BCS class 1, 2, 3 and 4. BCS 1 and 3 are the categories in which the drug substances have high solubility, while BCS class 2 and 4 have the low solubility. The solubility enhancement is done for drugs which belongs to BCS class 2 and 4. BCS class 2 drugs are low soluble and high permeable. That means if you increase the solubility, then the BCS class 2 drugs will get highly absorbed because they have high permeability. BCS class 4 drugs are low soluble and low permeable, but solubility enhancement is required, though there is limitation of the permeability, because the first stage is solubility and the second stage is permeability. That's why BCS class 4 drugs are required to be improved for solubility. Once the solubility is improved, there will be more absorption, and that's why the bioavailability will get increased. There are various classes of the drug substances like freely soluble, soluble, sparingly soluble, slightly soluble, insoluble and practically insoluble, and some are others also. The solubility improvement technique is required when the drug is insoluble and if the solubility improvement increases the bioavailability. Generally, BCS class 2 and 4 drugs are required to be made more soluble to enhance the bioavailability. Different segments are there on which the work is required to be done for bioavailability enhancement. First is API or drug substance improvement. Second is formulation improvement. If the solubility is increased, then dissolution will increase, and if dissolution is increased or enhanced, then there is chance of the improvement of the bioavailability. The solubility improvement in which the drug substance is modified, these are like particle size reduction, solid state form selection, crystal modification, salt formation, prodrug formation, complexation or drug dilution. So these are some of the technologies which are related to the API. If you get the insoluble API and if it is said that you go for the tablet formulation or capsule formulation, so first step you should think about the particle size reduction, because it is the first stage, or you can say it is one of the cheapest type of procedure to enhance the dissolution. You decrease the particle size, increase the surface area and see whether it improves the solubility or not. So particle size reduction, micronization, nanonization to increase the surface area, increase the dissolution and bioavailability. This is one of the technique. It is API related technique. Then solid state form. Select the crystalline form or amorphous form. Generally, crystalline form are less soluble compared to amorphous form. Crystal modification. If you work on the crystal modification, there are chances that the API will have increased intrinsic solubility. Then salt formation. Some drugs are having the basic or acidic nature, and based on that, the salt can be prepared. To increase the solubility, dissolution, and bioavailability. Same drug may be formulated or may be modified into different salt forms, and you select the salt form which is having more solubility. Complexation is the another way. Use of cyclodextrins like solubilizers or complexing agents to increase the solubility. Use of ion exchange resins. Then drug dilution. Some drugs are solubilized and absorbed onto the soluble carriers to improve the solubility. Then solid formation or pseudopolymer formation, hydrate formation, and many more are there. The technologies to improve the solubility of drug substances. Then formulation related factors. If you have a chance to use the surfactants or wetting agents, then you should select the surfactant and then its concentration to improve the solubility of the insoluble API. So use of surfactant or solubilizer or wetting agent can be done to enhance the solubility and dissolution. And in turn, the enhanced dissolution will improve the bioavailability. Use of polymers. Many polymers are there which improves the wetting, solubility, and also the bioavailability. Like povidones are there, HPMC, HEC, and many others. Process selection. If you are doing dry granulation or if you are doing direct compression, then if you want to increase the solubility, go for wet granulation by top spray or by RMG. You can go for aqueous granulation, hydroalcoholic granulation, or you can go with the organic solvent granulation or non-aqueous granulation and see whether it is improving the solubility or not. Sometimes use of the water may give you good solubility. Sometimes use of the solvent may give you good solubility. That is based on the molecule property and the process. Then formulation related factors. Like we have studied the use of surfactant, solubilizer, wetting agent like sodium lauryl sulfate is there, polysorbates is there. These are the excipients which improve the solubility. Use of polymers like povidone, HPMC and others. Some polymers also inhibit the precipitation of the API, or you can say that these maintain the solubility of the drug substance in the GI and thereby they improve the solubility and dissolution. Process selection like wetting with solvent, water, dry granulation versus wet granulation. These are the techniques. Use of super disintegrants like cross carbonyl sodium, cross povidone, sodium starch glycolate, or polacrylene potassium. These are the super disintegrant used to enhance the disintegration and dissolution. Then use of pH modifiers. Sometimes the use of acidic material or excipient, use of basic excipient can improve the solubility of the formulation. These materials change the microenvironmental pH and thereby increase the solubility and dissolution. The basic materials like meglumine is there, NaOH is there, then acidic material citric acid is there, tartaric acid is there. These materials enhance the solubility. Then formulation technologies, or you can say the process technologies like solid dispersion technology. Solid dispersion technology is done by mainly hot melt extrusion and spray drying. These processes use the polymer and the API get dispersed and dissolved in that polymer, and that's why the solubility is improved. Then use of co-precipitation type of technology, use of rota evaporation, melt granulation, twin screw granulation, hot melt granulation, use of surfactants. Many technologies are there to improve the solubility and bioavailability. Then self-emulsifying drug delivery systems can be made. Then self-micro-emulsifying drug delivery systems can be made, and solubility can be improved. Soft gelatin capsule formulation can be made for the drugs which are insoluble, and if these materials are soluble in the lipid type of excipients. So use of lipid carriers can be done. Use of oils can improve the solubility and dissolution and thereby bioavailability. A lot of soft gelatin capsules formulations are there by which the drug solubility is increased. Making the oral solution formulation instead of oral tablet or capsule formulation may give you good bioavailability. Making the suspension formulation can improve the bioavailability and dissolution. Use of pellet formulation instead of tablet or capsule formulation may give you good bioavailability and dissolution. Pellet formulations are the formulations in which the drug is coated onto the solid carriers like sugar pellets or MCC pellets, and thereby their surface area is increased and the solubility is enhanced because of the larger surface area and uniform particle size of the pellets. Also, these pellets distribute throughout the GI, and then these can release the API at a faster rate. So pellet formulation can be made to increase the resolution and solubility. So increasing the solubility will improve the dissolution, and improved dissolution will help you to enhance the bioavailability. So these are some of the techniques. I hope you might have got good understanding out of this video, and I will say that you should keep on watching these videos so that whenever you are going for an interview, you will remember all these things and you will have a better chance of getting selected in the pharmaceutical interviews. Thank you for watching the video. Please do like, share and subscribe to this channel. Thank you.